Hello, my name is Morgan Goldsmith and I'm a registered nurse and Director of Clinical Marketing and Education for Hospi Corporation. In this video, I'll be reviewing the components of the Macy Catheter tray, which contains everything you need to place the Macy catheter and administer prescribed fluids or medications. I'll then demonstrate the procedure for Macy catheter insertion, fluid administration with the gravity bag, and catheter removal and reinsertion. If you are using the Macy catheter for medication administration, you may also want to watch our companion video using the Macy catheter, which can be seen by visiting macycatheter.com. The Macy catheter is a prescription-only device. The FDA indication for the Macy catheter is to provide rectal access to administer liquids and medications. The Macy catheter tray has everything needed for insertion, medication administration, and hydration. Components include everything you need for the first insertion and reinsertion of the catheter. Fluid administration via the Macy catheter is a simple, comfortable, and safe procedure. The following is example procedure only. Please follow your facility-approved policy and procedure for use of the Macy catheter for fluid administration. Before the procedure, you will want to assess the patient for the need to have a bowel movement and assist as necessary. First, follow your agency's guideline for labeling the Macy catheter tray with the patient's name or identifier and date of insertion. Make sure that any of the surfaces that you place the tray on have been cleaned according to your agency's protocol. As always, wash your hands before starting any procedure and begin by explaining the procedure to the patient. Next, open the tray by peeling back the top cover. Be careful to leave an edge of the cover attached to the tray. This will allow for future identification. Then, place the open tray on the clean bedside table. Put on the first pair of gloves and unfold the poly towel directly on the table. Next, open up the catheter package and place it on the towel. Fill the medicine cup with at least 15 ml of room temperature tap water. Place the tip of the 20 ml Luer syringe into the medicine cup and withdraw 15 ml of tap water into the syringe. Place the syringe on the towel next to the Macy catheter. You are now ready to insert the Macy catheter. Inserting the catheter is easy, fast, and is a non-sterile technique. Insertion only takes about a minute. First, lubricate the first few inches of the catheter to the first arrow. Position the patient on the side or in supine position with their knees bent and insert the catheter to the line between the two arrows. Remove the red safety cap and inflate the balloon with the Luer syringe to 15 ml. Check placement by making sure you can see the arrow pointing towards the patient's body and gently tug on the catheter to ensure the inflated balloon is snug against the inner portion of the rectal sphincter. Finally, secure the catheter by running it between the legs and securing to the thigh or lower abdomen. You are now finished with this simple insertion procedure and ready to begin fluid administration. First, remove the gravity bag provided in the Macy catheter tray and label it with the patient's name, prescribed fluid or hydrating solution, and any other information your agency guidelines require. Next, fill the gravity bag with the prescribed volume of hydrating solution to be given for infusion and hang it on the IV pole at least 2 feet above the patient. Then, remove the protective cap from the end of the gravity tubing and place the cap in the Macy catheter tray for later use. Finally, after ensuring that the patient is in left side-lying position, prime the gravity bag tubing and attach the gravity bag adapter to the medication administration port of the Macy catheter. Set the infusion rate as prescribed by the ordering physician or practitioner. For a drip rate calculation, follow the chart on the Macy catheter tray information sheet provided in the tray. As a reminder, before leaving the room, ensure the patient has the call light within reach. Assess the patient every 30 minutes for comfort during the infusion. Following the completion of the infusion, or if the infusion needs to be paused, you can simply clamp and disconnect the tubing from the medication port and reattach the cap on the adapter on the end of the gravity bag tubing. It can be helpful to hang the tubing on the IV pole in case you need to use it again on the patient. Post-infusion, the patient should remain on their left side for 30 minutes. If possible, they can then be assisted to the bedpan or toilet if necessary. While it isn't typical for a patient to experience cramping during a procedure, if the patient does complain of cramping or discomfort, stop the infusion for 30 minutes and then reassess. If the patient is comfortable, you can restart the infusion. If the patient is still having discomfort, it is likely the patient needs to move their bowels. If this is the case, remove the Macy catheter from the patient following the catheter removal and reinsertion procedure outlined in this video, and assist the patient to the bedpan or toilet. Allow the patient to move their bowels. You can then reinsert the catheter, reinitiate, and complete the fluid administration based on your agency's protocol. It is important to remember that the Macy catheter is designed to remain comfortably in the rectum for up to 28 days. When a patient needs to have a bowel movement, the catheter can be temporarily removed. The catheter is also easily expelled if the patient is incontinent and will not inhibit bowel movement. If removed or expelled, it should be replaced immediately following the bowel movement. Otherwise, a new catheter should be used. The Macy catheter should not be stored for later use. This is an example procedure only. Please make sure to follow your facility's guidelines for removal and reinsertion. Ensure the surfaces that you'll be using have been cleaned per your agency protocol. As always, wash your hands before starting any procedure and begin by explaining the procedure to the patient. After putting on gloves, place a clean barrier such as a poly towel on the table. Place a 20 ml Luer syringe from the Macy catheter tray and place the syringe on the barrier. If you will be reinserting the catheter, place a water-based lubricant packet on the barrier too. These removal and reinsertion supplies should be available in the patient's Macy catheter tray if you labeled it and stored it at the bedside. With the patient in side-lying or supine position, attach the 20 ml Luer syringe to the balloon inflation valve of the Macy catheter and gently draw the 15 ml of water from the balloon. Next, gently remove the catheter from the rectum and wipe the end of the catheter that is soiled in the direction from clean to dirty toward the tip of the catheter with a washcloth moistened with water. Do this until all visible soiling is removed and place the catheter on the poly towel barrier. Keep in mind, if the catheter is soiled with bodily fluids near the medication port or balloon inflation valve, the catheter should be discarded and replaced with a new catheter. Next, remove your gloves and discard them according to your agency's guidelines and wash your hands. If needed, assist the patient to the bathroom, commode, or bedpan. If the Macy catheter is to be reinserted, wash your hands and put on the third pair of clean gloves provided. Lubricate the catheter, insert to the marker line, inflate the balloon with 15 ml of water, gently tug, and secure the catheter. You can then discard all the used components of the tray. Note, the Macy catheter contains everything you need for the first insertion and reinsertion of the catheter. If you need to reinsert the catheter multiple times, you may need to obtain more gloves, poly barriers, balloon inflation syringes, and water-based lubricant. If you are discarding the catheter because you are done with fluid administration or because you are reinserting a new catheter, follow your facility's guidelines for properly disposing the Macy catheter. As a reminder, always wash your hands following proper disposal of the catheter. That's all there is to it. Please visit our website at macycatheter.com for more information.